what we can tell, that people have overwhelmingly been doing the right thing. And I don't underestimate for a single second how difficult this will have been for so many of you. But your actions this weekend have been crucial. By staying at home, you are helping us to slow the spread of COVID-19. You are helping to protect our National Health Service and stop it being overwhelmed. And you are undoubtedly helping us to save lives. So thank you for sticking with it. And we all know how difficult that is. There is, of course, due to be a review of these restrictions this week. But I want today to be very clear so that nobody is under any illusion that that review is not likely to result in these restrictions being lifted in the very near future. There are early optimistic signs that the steps we are taking are working, but until we know more, until we have solid evidence, we must stick with it. We all want these restrictions to be lifted as soon as possible, and as I have said before and will say again today, they will not be in place for a single minute longer than is necessary. But we also know that if we lift these restrictions too early, or if we do so without thinking through properly how we can ease the restrictions while also still keeping the virus under control, then we risk the virus spreading out of control. We risk it overwhelming our National Health Service, and of course we risk it taking many more lives. So I know that this way of living our lives right now is not easy, but it is still essential. So once again, let me thank all of you for the effort and the sacrifices that you are making. I also want, as usual, to provide you with an update on some of the key statistics in relation to COVID-19 in Scotland. As at 9 o'clock this morning, there have been 6,067 positive cases confirmed. That is an increase of 155 since yesterday's figures. It is, however, important for me to note right now that we do not yet have testing figures for the last 24 hours from labs in Tayside or Ayrshire and Arran. Otherwise, the number that I have just reported would have been higher. Across Scotland, a total of 1,797 patients are in hospital with COVID-19. That is an increase of 42 from the figures that were reported yesterday. And a total of 211 people last night were in intensive care with either confirmed or suspected COVID-19. That is a decrease of 10 on yesterday's figures, although, again, I would caution against reading too much into that at this stage. And it is with sadness that I must report that there have been 9 further deaths of patients who had tested positive for COVID-19. That takes the total number of deaths in Scotland to 575, although I want to sound a note of caution about that figure in 2 ways. Firstly, the 9 that I have just reported is lower than in previous days, because while it is now possible to register deaths 7 days a week in Scotland, we will always expect the number registered to be lower at the weekend, and that is undoubtedly particularly true over the Easter weekend. So I would expect the figures to be higher tomorrow and the following day as any deaths from the last few days are registered. But the second point is this one, and it's a point I've made before, but it's really important to stress that these figures that I have just reported today only include those deaths where an individual had tested positive for COVID-19. On Wednesday, National Records of Scotland will publish its second weekly report detailing all registered deaths from COVID-19. That means suspected as well as confirmed. And this week's report will also break down these figures by the location of someone's death. That means they will show whether an individual died in hospital, in a care home, in their own home, or in another location. And I want to take a moment just to acknowledge that there are particular concerns about people in care homes. And I want to give a very strong assurance, firstly, that we are working hard with the Care Inspectorate to provide appropriate support for care homes, their staff and their residents. And secondly, we're working hard to ensure that we can publish full and robust information about numbers of cases in care homes, which we hope to do later this week. Above all, though, I want to reflect, as I always do in my own mind when I give the numbers of people who have sadly died, that they are not just statistics. They represent individuals who were mothers and fathers, grandparents, sons, daughters, siblings, spouses and partners. They are all unique, valued human beings whose loss is a source of grief to others. So we mourn their loss and we extend our deepest condolences to all those who are coming to terms with life without them. I also want once again to thank everyone who is working so hard in our health and care sector for the incredible work that you are doing. All of us owe you an enormous debt of gratitude, and I want to repeat my assurance to you that we in government will do everything we can to support you, and we will work hard to quickly address any concerns that you have. That is a responsibility that I, the Health Secretary, and all of us in the Scottish Government take, both very seriously and very personally. I have two things that I want to briefly update you on today, which are both about the non-NHS support that we're seeking to provide for people facing challenges, both from this virus and also from the restrictions that we have put in place to try to slow the spread of it. The first relates to the Scottish Government's support for charities and third sector organisations who are providing such vital community services at this time. We announced 4 weeks ago that we were establishing a £350 million emergency package of support for communities. This included a £50 million wellbeing fund for third sector organisations. £10 million of this has been allocated for immediate priorities, and £7 million of funding has also been allocated to support around 2,000 charities with small grants. However, the majority, up to £33 million in total, is open to bids from third sector organisations. We know that third sector organisations are playing a vital part in protecting people's welfare and well-being during this crisis, so we want to do everything we can to support them as they support people across the country. If third sector organisations need funding to continue providing important services, or if they know that they have good ideas for new services which could help people in these really difficult times, I would encourage them to apply. Expressions of interest can be registered from today, and further information is available on the website of the Scottish Council for Voluntary Organisations. The second piece of information I want to provide today is to confirm that from tomorrow there will be a new telephone helpline for people who we know face significant challenges as a result of COVID-19, but who are not in what we call the shielded group and therefore receiving bespoke support. So the kind of people I'm talking about now are, for example, elderly people, those over the age of 70, people with disabilities, those who require support for mental health services, those who are pregnant, and those who receive a flu jab every year for other health conditions. So if you are in one of these groups and you're not already getting shielded support, this free helpline is open to you. It will, as I say, open tomorrow. The number is 0800 111 4000, and it will be available in daytime hours during the week. It is intended for those in the groups I've mentioned and who do not have family or existing community support to access, for example, food and medicines, and who cannot get online to access that kind of support. So if you are in one of these categories and didn't get the number just then, I'll give it again in a moment or two, so you've got time to get a pen so that you can note it down. But if you call that helpline, you will automatically be connected to your local authority, who will then help you access the services and the support that you need. And that might include essential food and medication, contact with local volunteer groups, emotional support, or links to local social work services for vulnerable children or adults. It is worth repeating that this service is in addition to the localised support which is already available for people who have received the letters advising them to shield themselves. And it is, as I have said, intended for those who don't have other means of support and cannot obtain help through other means. We don't want, as far as possible, anybody to be falling through the net and to be isolated at home without the essential help that you need. So this is about providing people who are vulnerable with a further way of getting essential help. So I'm about to give the free helpline number again, and I stress you'll be able to call this from tomorrow. The number is 0800 111 4000. Anyone, of course, who's not in these categories but is still looking for some support or advice can find that on the readyscotland.org website. Now, I'm about to hand over to the Interim Chief Medical Officer and then to the Cabinet Secretary for Health. But before I do that, I want once again to repeat the key public health messages. Please stay at home unless it is for an essential purpose, such as buying essential items or exercising. If you leave the house, stay 2 metres apart from other people and do not meet up with people in households that are not your own. If you have symptoms of COVID-19, self-isolate for 7 days. That means not going out, even for essential purposes. If someone in your household has symptoms, that instruction to self-isolate applies for 14 days. Again, I know that these rules are really difficult. I know that they will have been especially difficult over this holiday weekend, and they will not get any easier as the days pass. I know that. But they are vitally important and they are making a difference. Please know that they are making a difference. By staying home, we can all help slow the spread of this virus. We can protect our precious National Health Service and we can save lives. So thank you once again for doing the right thing. And I'll hand over now to Dr Gregor Smith, the Interim Chief Medical Officer.
Thank you, First Minister. Unfortunately, death is a subject that we continually have to turn to when discussing COVID-19, and today I want to just again acknowledge the terrible burden that some families are experiencing just now as they deal with that loss. We recognise that this is a very difficult time for those who have lost someone, not only from COVID-19 but from other conditions as well. As a GP, it's only too real to me the support that some people needed during that grieving process, and I would ask everybody to bear that in mind and to try to offer their own way of support, recognising the need for social distancing, but to be able to call upon people in other ways to try to offer them support at this difficult time. In the cultures that we see across Scotland, the process of saying goodbye plays a very important part in that grieving process. However, at this time it's very important that people do not delay funerals of their loved ones. It's important that people are able to grieve the passing of a loved one, but delaying the funeral in anticipation of social distancing measures being lifted could increase strain on funeral and mortuary services responding to coronavirus. We respectfully ask that families do not delay the funeral of their loved ones as a result of adherence to the NHS advice on social distancing, on shielding and in self-isolation, or because they're waiting for these emergency measures to be lifted. Please let me be clear. The measures to help protect us all during this pandemic are going to remain in place for a significant period of time. This will include the restrictions on who can attend a funeral service. This isn't a request only directed to those who have sadly lost loved ones to COVID-19. This affects us all across Scotland. On average, there are 57,000 deaths a year recorded in Scotland. That's about 1,000 deaths a week. Those deaths from other causes also continue. We're working very closely across Scotland with funeral directors, crematoriums and burial grounds to monitor and address the sector's ability to deliver as normal a service as possible during this current pandemic. The sector can cope if everyone understands and appreciates the circumstances we find ourselves in and continues to arrange a funeral for the loved ones as normal, and again I stress, please, without delay. I want to end by thanking everyone for their continued efforts to limit their own contacts outside their household. Those actions are the most important that you can take to help limit the spread of coronavirus and to directly play your part in saving lives across Scotland. Thank you.
Thank you very much, Gregor. These are really difficult messages. Please know they are difficult messages for us to be giving. We don't do so lightly, and I know they are even more difficult messages for all of you to hear. But please understand that we give them because we judge these measures to be essential. And I would ask you to listen carefully and to comply as much as possible, because they are all part of this national collective endeavour to try to ensure that coronavirus doesn't take any more lives than is absolutely unavoidable. Thank you for that. I'm now going to hand over to the Health Secretary, who will say a few words, and then we will open, as always, to questions.
Thank you very much, First Minister. Can I also offer my sincere thanks to all of you for following those public health messages over the weekend, staying at home, protecting yourself and your family, but also protecting our NHS. I thought it would be useful today to provide a snapshot of some of the statistics over the weekend to give an illustration not only of the work that we are undertaking to ensure that our NHS is ready and coping with the demands of the pandemic on it, but also how your efforts matter. As the First Minister has said, NHS boards reported that as of midnight last night, there were 211 suspected or confirmed cases of COVID-19 in ICU. Together with 55 other non-COVID patients, our numbers in ICU were 266. Boards now have a surge capacity. That means they have the beds ready, the ventilators and the trained staff of 585 beds. They can be resourced immediately. That, in effect, trebles our original capacity and shows that as the virus progresses, at present, our capacity is sufficient to meet anticipated demand. But boards will continue to work as staff are continue to be trained to reach our objective, which is to quadruple the number of ICU beds to 700. We've also successfully secured 3,000 of our bed capacity in our NHS estate for COVID patients. Of course, the NHS Louisa Jordan will add to that when it is ready from next week. And an important effort that was made and was successful, important for that bed capacity, but also important for the patients involved, was the significant reduction, the 60% reduction in the number of people in our acute hospital setting who no longer needed to be there for clinical reasons, who were then able to leave hospital, to return to their home or to that homely setting. That was a significant effort and piece of work by our health and social care partnerships and by our health boards, and work that will continue in the days ahead. The other area where we have been increasing our efforts is in our frontline response through NHS 24. By encouraging people to use the NHS Inform website as the first port of call and contact 111 only if their symptoms worsen, we have seen a marked reduction in call volumes and, as a consequence, a marked improvement in response times. We continue to explore what more we need to do to increase capacity for NHS 24 to ensure that we can answer calls quickly and meet the demand and improve the performance further. But what is clear from all of that is that the efforts you are making, the sacrifices that you're undertaking, and the work of our health and social care staff all are moving towards the position where we are protecting our NHS. We are ready to cope with the demand that the pandemic will bring to us, and we are very grateful to everyone for everything that they have done so far.
Thank you very much, Cabinet Secretary. I'm now going to go straight to questions from journalists. As always, we've got a long list of questions and I will get through all of them, but I would ask the journalists in questioning. Kay Nicholson from STV is first.
Good afternoon. First of all, just going back to the care homes, you mentioned that at the start, First Minister. It's been 4 weeks now since the World Health Organization said countries need to test. Today we've spoken to one care home provider which says testing is still a postcode lottery, particularly for elderly care home residents and those working on the front line in care homes. They're saying that they're being treated as second-class citizens despite care homes being such a problem area. What would you say to those claims, and are you confident that enough is being done to escalate testing at this time?
Well, firstly, can I say categorically and very directly and personally, everybody matters in this. Everybody matters regardless of age or where they live, whether they live in a care home or whether they're being treated in hospital. So there is no sense that any group in our society is less important than another. And I think it is really important to understand that is the case. On care homes, generally, I mean, let me firstly take the issue of testing. We are increasing our testing capacity. We have set out previously what the objectives and priorities for the utilisation of that capacity are. We are still working to make sure that the capacity as it increases is fully utilised by ensuring that our labs are working in a coordinated way. So we are seeing more health and care staff tested, which is where they are testing negative, enabling them to get back to work. In terms of residents within care homes, from the very outset of this epidemic, care homes have had guidance available to them about how to manage situations where residents have suspected symptoms of coronavirus and how to reduce the risk of that. Unfortunately, as with the rest of the population, that does mean a greater isolation of people within their own rooms rather than in communal parts of care homes. And the Care Inspectorate is working very closely with the sector to make sure that support is available, and where tailored and bespoke support is required, that is being made available. So this is an area, for obvious reasons, and given the risks of any infection spreading in that kind of environment, that we take very, very seriously. And my last point is about the transparency around all of this. On Wednesday, the numbers of deaths that will be reported by National Records of Scotland, which of course, as I said earlier on, encompass not just those where there has been a positive test confirming coronavirus, but also those deaths where it is included on somebody's death certificate as suspected or a possible contributory factor. Those figures will be broken down by location of death. So we will be able to see the numbers that have died in a care home, and I think that is important that information is publicly available. And as I said, in addition to that, we are wanting to get to a position later this week where we can also publish reliable and robust figures for number of cases in care homes. But I don't want that to in any way dilute the very strong message that preventing infection in care homes is a key priority, and one that the sector, with the support of the Care Inspectorate, is extremely focused on. David Henderson from BBC Radio Scotland.
Thanks very much, First Minister. The death toll in the UK is predicted to be one of the worst, if not the worst, in all of Europe. That's according to the UK government advisor, Sir Jeremy Farrar. What are you doing that's substantially different from the UK government's approach that would mean Scotland isn't just as badly hit? And even if the timescale isn't clear, do you have an exit strategy from the lockdown? What does it look like? And how do you expect it to be different from a plan which applies to England?
Well, let me try and take those points one by one. Firstly, it is really important that as we go through this pandemic, and particularly as we come out of the other side of this pandemic, that we do have an ability to compare experiences in different countries. That's important for accountability, but it is also really important to make sure that any lessons are learned for the future. I would simply make 2 points about that. Firstly, when we are comparing country to country, it is important that we develop measurements and ways of making sure we're comparing like with like. Some of, perhaps not all, but some of the comparisons we see right now are not necessarily comparing like with like, and perhaps don't take account of all of the key factors that would require to be taken account of. And the second thing is that I think we just need to be cautious about making comparisons at a particular stage, because we're not through this pandemic yet. We do see, and obviously I'm not an expert on what's happening in other countries. My responsibility is to oversee the management of this in Scotland. But we do see some countries that had lifted restrictions that are seeing an increase again in numbers of cases. So we have a way to go in this pandemic, but the ability to compare and to learn lessons as we go, as well as when we're through this pandemic, is really important. And again, as with all of this, transparency there is key. In terms of Scotland's approach, all along, the key priority that has driven our approach has been to save lives. You know, I stand up here, we all stand up here every day and talk about the importance of the measures we're asking people to comply with from the point of view of slowing spread, protecting the NHS and saving lives. That is what everything we are doing is geared towards trying to achieve. Unfortunately, in a pandemic, as I report here every day, people are dying from this virus, and each and every death is deeply regrettable. But the focus and the objective is to reduce the number of people who lose their lives from this, and that has been the priority all along. In terms of exit strategy, we need to understand a bit more than we do right now about the impact these measures have had collectively and individually, because there's a number of different measures that have been introduced at different times, and we need to understand what the impact will be on starting to release these measures, and we need to make sure that we have in place an ability to continue to control this virus even as we lift these restrictions, because the virus will not have gone away. We will have suppressed it, and the danger is as we lift restrictions, it starts to increase again. And that means that there is an importance, I've said this before, and I think we will continue, we'll hear us talk more and more about this. There is an importance at that point to make sure testing, tracing, isolating, effectively what you do when you go back into a contained strategy, it is there as part of that exit approach, and that is the work we are doing right now, but we need to make sure we fully understand the evidence before we start to release any of these measures. Now, the last point is, will we do this at the same time in Scotland as in the rest of the UK? And that will depend on what the evidence tells us. This is not some point of constitutional ideology either way. Ideally, I think for the reason of simplicity of messaging to people, the more consistency across the UK we have in what we're doing, the better. But if the evidence tells us that we need to do something different in Scotland to the rest of the UK, or do it on a different time scale, we will not hesitate to do that. It is absolutely vital right now that we take decisions on the basis of the best evidence we've got, and we take those decisions with that key objective in mind. Slowing the spread, keeping the virus under control, protecting the NHS and saving lives. So these are the principles that will continue to guide us. Jack Foster from Global.
Good afternoon, First Minister. I'm not sure how aware you are of reports from members of the Roma community in Govan Hill in Glasgow who said they've received racial abuse and accusations that they've been flouting lockdown rules. In fact, it transpired that photographs which had been shared online, including one of a family funeral, were taken in different cities and before the lockdown had even begun. I mean, I suppose there's wider questions here, not just about racial prejudices, but generally about people trying to police their neighbours during this crisis. But what is your reaction to Roma community leaders who've said that as many as 50% of them have left Scotland because they don't feel safe, due in part to COVID-19 itself, but also the associated ramping up in prejudice they've experienced?
Well, obviously, I know Govan Hill, where the majority of a Roma population live, very well indeed. It's part of my constituency. It's where my constituency office is located. And yes, I have seen and heard some of the concerns that have been expressed over recent weeks. I do know there have been examples of pictures circulated that turned, alleging that it was something in Govan Hill that turned out to be pictures of other parts of the UK. So I would say two things, and I know my office certainly has close and ongoing dialogue with the police around these issues. But I would say two things. Firstly, the rules on social distancing and isolation and staying at home apply to everybody, and they must be adhered to by everybody, because that is essential to allow us to ensure that we meet the objectives of them. But secondly, racism and prejudice and trying to stigmatise any group is as unacceptable during a time of crisis like this as it is during any other time. I don't want to see anybody feel unsafe or unwelcome in Scotland, and I think we will handle this emergency crisis situation better, and I think in the main we are handling it well by coming together and by trying to support each other. These are tough times for everybody, and people's tempers fray and people's frustrations rise, and all of us understand that, but we all just need to remember that people experience these restrictions differently because of different circumstances, and I don't think it's helpful to ignore that. But ultimately, pulling together and looking out for each other and supporting each other through this, even as we have to stay physically separate, will help us get through this much more strongly. And that applies in Govan Hill, it applies in every single community across the country. And I would appeal to people to just remember the principles and the values of kindness, love and solidarity that we've spoken about often are the ones that I think we need to make sure we apply to others as we would want them to apply to ourselves. I've got James Matthews from Sky.
Thanks very much, First Minister. There are many in our care sector who would endorse that message of kindness, love and solidarity in practical form, full personal protection equipment. Can I ask for two figures? How many health and social care workers are there in Scotland? And how many have ready access now to full personal protection equipment that will see them through the week?
We, on a daily basis, are working to make sure that everybody in our health and care sectors, I'll provide the precise figures that you've asked for. I don't want to do it off the top of my head and not get them accurate, so we'll provide specific figures. But the general point I want to stress here is that we want to make sure everybody has the PPE that they need when they need it. And that's an ongoing challenge and an ongoing responsibility. There is not a single day goes by when I, the Health Secretary, the CMO, everybody is focused on that, and it involves daily monitoring of a number of different things. The supplies we have, whether those supplies are sufficient, whether there are pressures on those supplies and what we can do to ease those pressures. The distribution, are we making sure that those supplies are getting to where they are needed to be? We have a number of systems in place, a number of ways of monitoring that. There is the email address that people can come to us. People are messaging us all the time. I picked up a particular tweet myself yesterday of a care home provider that had contacted me so that we could get onto that and try to resolve that there and then. We also need to make sure, and we took a big step forward on this last week with the agreement between the government, COSLA, and the unions, making sure that there is confidence in when frontline staff should be using PPE, and that they feel they have the training and support to use it properly. So these are things that I will never stand here during this outbreak and say these things are off the agenda, because we fixed them all. We will monitor that and keep on that on a day-to-day basis, such is the vital importance of it. Jean, do you want to add?
I had another call myself this morning with a number of officials, including from our national procurement, looking at where we are right now in terms of current stocks and the orders that are coming in over this week, but also looking at what more we can do to make sure that we're asking existing suppliers if they can increase their productivity. We're looking at bringing new suppliers into market with proper due diligence so that what they can provide for us is of the quality that is needed. And with the additional work that the First Minister has talked about those direct order lines and direct distribution channels, so that we can get what is needed to people as quickly as possible. But that email address that the First Minister mentioned is monitored constantly. It has ministerial oversight, and our aim is whatever the issues are that come up there, we address them directly and try to resolve them as quickly as we can. And I don't expect either that during this period that I will ever let up on making sure that we have the right PPE in the right place for the right staff, so that they are safe and that those that they are caring for are safe too.
And I say this again directly and very personally to anybody out there watching who works in health and care, or who has a relative or a friend who works in health and care. If you have concerns, if you don't feel you've got what you need, if you don't feel those concerns are being addressed by your management, use that email address. It's available on Scottish Government social media feeds, and that will come direct to us. There are few things I and the Health Secretary take more seriously in all of this than making sure those who are working so hard for us have the protection they need. I can't promise there will not be glitches along the way, because that is the nature of what we're dealing with, but we will strive and do everything we can to sort them out as quickly as possible, and that's a personal commitment that I will continue to give. Greg Fluker from Wave FM.
Good afternoon. It's been said the decision to put us into lockdown 3 weeks ago was based on advice from scientists, but a lot of people are suggesting the UK made a mistake by not going into lockdown earlier. With hindsight, are you happy with the timescales and the effect it's had on infection rates?
Look, we took decisions. I, as First Minister, took decisions based on the best advice we had. And in the fullness of time, there will be rightly and properly a lot of scrutiny of what was done and not done, and whether that was the right or wrong thing to do. And as I say, I think that is absolutely right and proper. But the decisions were taken on the basis of the best advice. And as a politician, I have a duty to interrogate and ask questions of that advice and apply judgment to it. So that's what we have done. That is what we will continue to do. And what I'm about to say is not intended, so please don't take it as a comment on what other parts of the UK did or didn't do, but when these lockdown measures were applied, Scotland was, I think, at an earlier stage of the infection curve. So I would hope that we would see the impact of that. We took certain decisions for reasons that we set out at the time here in Scotland to ban large gatherings slightly earlier than the rest of the UK. And these were decisions I took on the basis of the best advice that I had available. And that's what I will continue to do. None of us are infallible. None of us are dealing with a situation that we have dealt with before. So I, as First Minister, will try to get the best advice I can, apply my judgment and interrogation to that advice, and always act in a way that is about protecting life and protecting people from this virus. And as I said earlier on, in due course, there will be a lot of scrutiny about decisions that were taken. There will be a lot of comparisons made, but it's important they're made on the right basis and at the right time. Can I go now to Conor Gillis from BBC Scotland?
Thanks very much, First Minister. The UK Government has confirmed plans for a new NHS app for contact tracing. Essentially, it's going to warn users if they've recently been in close proximity to someone who's thought to have been infected with the virus. It's going to be tested in the north of England shortly. Is the Scottish Government involved in this? And if not, is there a separate app for Scotland?
We have been involved in discussions about this. I'll maybe ask Gregor to say a word just about how these discussions take place, and we are obviously monitoring that. I said earlier on, when we get to a point where we are starting to lift some of these restrictions, and unfortunately I don't think that will be in a matter of days, but when we get to that point, the ability then to test, trace and isolate, as it's called, because we're back in a situation of trying to contain as opposed to delay the virus, becomes really important. So technology undoubtedly has a part to play in that, and people will always, when technology is used in these kind of ways, will want to be assured about privacy and other issues that matter to people, but undoubtedly technology will have a part to play in this. Gregor?
So I think it's really important that as we kind of enter this kind of next phase where we're likely to return to trying to go back to a kind of mechanism of containment, we're using all the mechanisms that are available to us to make sure that we've got a strong approach to identifying those who are infected and being able to not only give them advice, but anyone that's been in contact with them. One of the mechanisms which is of real interest, and we've got members of our digital community who are strongly linked into this, is this new app that you've described. And I think that although that is still developing, it's still to be tested, it certainly looks very promising as a mechanism by which we can strengthen that approach. We've got to ally that to traditional methods of contact tracing as well. And I think that if we use a combination of those methods at this next phase, we will be in a much stronger position to be able to kind of quickly identify people who have perhaps been exposed to the virus and give them the appropriate advice so that they can self-isolate at that point and reduce the likelihood of the virus spreading.
Okay, thank you. Neil Pooran from PA.
Thank you.
Sorry, Neil, we're not hearing you.
Hello, can you hear me now?
Yes.
Thank you. Earlier today, the CEO of Renaissance Care Homes in Scotland said that the pay rise that was announced for care workers wasn't actually new money. I just wondered if you could respond to that. He said that this was in fact a pay rise that had already been agreed.
I'll ask the Health Secretary who announced this yesterday, and I think the care workers who will get this money will certainly feel the benefit of the new money that will be in their wage packets, which is actually the least that they deserve, particularly at this point. But I'll hand over to the Health Secretary to say a bit more.
So the 3.3% increase that I announced yesterday in conjunction with COSLA, an agreement reached with the Convention of Scottish Local Authorities, is different from normal in two particular ways. First of all, it is 3.3%. It applies across the adult social care workers providing direct care and support to adults in care homes, in care at home, in daycare and in housing support. And secondly, rather than wait normal times, we would go through a period of protracted negotiations and we'd eventually reach an agreement at some point towards the end of the summer, perhaps early autumn, and then it would be backdated. We took a view that it was important to reach that conclusion very quickly so that those adult care workers could receive the increase as quickly as possible to as near as possible to the 1st of April. So that's what we've done. It is new money in the sense that if we hadn't reached that agreement, that is not money that we would be spending in that way. And the other important part of it is, of course, that it is paid from the 1st of April, and the decision was taken just there at the weekend. The other thing I would say, though, of course, for any owner of a care home or provider of care who wishes to pay more than that, then they are, of course, very welcome to do so. But we've made sure that those adult care workers in social care across all those sectors receive, as a minimum, that important value of the work that they do.
Mark McLaughlin from The Times.
One for the CMO, I think, is quite a technical question. The First Minister mentioned test, trace and isolate quite a few times during today's session, and that'll be after we've flattened the curve. Will test, trace and isolate bring down the percentage of people that you would require to be infected in the population? We saw the modelling that it was 60% for herd immunity. Will test, trace and isolate bring that 60% down, or is it just a slower route to that same 60%? The Sunday Times also reported yesterday a paper that was circulating in Whitehall that said extra deaths not related to COVID could be 150,000 during the lockdown compared to 20,000 related to COVID. Did you see that paper? How does it relate to Scotland, and how does that factor into your modelling?
So one of the key features of test, trace and isolate, as you say, is once we get into a position where we've managed to suppress that pandemic curve that we've all become familiar with, where the number of cases in our communities is as low as we can confidently think it can be, is to make sure that what we're not seeing is outbreaks which are establishing themselves around about the country. So that test, trace and isolate is designed to make sure that we reduce the risk, particularly to those who are most vulnerable in our society, so that they're not being exposed to this virus and the terrible harms that it can cause. Now, one of the things that needs to go on, of course, in parallel to that in the background is the work which is advancing every day to develop other mechanisms by which we can intervene with this disease. So that might be the development of the research that tells us which pharmaceutical measures, which drugs can really help us to try to treat people once they become ill, but also the development of the vaccines as well. And it's those taken hand in hand, working together, that are most likely to make sure that we limit the harms that this disease is likely to cause as time goes on in the past. I haven't seen this particular study that you've referred to there, so I'm not going to comment specifically on that, but there are a range of studies published every day and then consolidated in many of the leading medical journals on a weekly basis that we are constantly learning from.
Okay, thank you. Chris Musson from The Sun.
Are you counting the number of COVID-19 deaths due to hospital-acquired infection of the disease? And if so, will you release these figures?
I'll hand over to Gregor in a second, but the whole issue here of nosocomial infection, how the infection is spreading in hospitals, is one of acute study and exploration, both to understand the extent of that, but also, and more importantly, to make sure that everything possible is being done in hospitals to restrict and reduce and contain that. My answer to every question about publication is where we have robust information, then we will. Our default will always be publishing it. So in principle, yes, but obviously we need to make sure that information that we are putting into the public domain is robust and reliable. So that's obviously one of the things that we will be considering further. Gregor.
So at the moment, the of that information just isn't available to be able to kind of publish that on a regular basis. It's an area of intense focus, not just within the UK, but actually across Europe and internationally, is the concept of nosocomial infection. This virus loves institutions, and of course hospital is an environment where if we are not careful, then it can spread very, very easily. So we need to understand from the lessons that have been learned from other countries as to how we try to combat that. Here in Scotland, we've already set up ways of looking at that in intensely more detail, and we're linked into the UK processes guided by the scientific community under the auspices of the kind of SAGE science group as to how we can properly identify the data and the interventions which can try to prevent and limit any spread within any of our institutions, whether they be hospitals, care homes or whatever.
Okay, thank you. Paul Hutchin from The Record.
Thank you, First Minister. New Zealand is a country of similar size to Scotland. A much stricter lockdown. They've carried out more testing and more contact tracing. And if you look at their number of recorded deaths, it's tiny compared to the 575 that you announced today. Do you accept that the approach pursued by Jacinda Ardern has been much more effective in combating this pandemic and saving lives than the approach pursued by herself and Boris Johnson?
I don't think it is possible to draw firm conclusions looking at different countries right now. I said earlier on, and it's a point I feel very strongly about, I think that kind of scrutiny is really important, not least so that we can all make sure we're learning appropriate lessons for the future. But there's 2 points I think we need to bear in mind. Firstly, when we are comparing different countries, that we are making sure we're comparing like with like. We're measuring different things, but also, you know, population size, population density, for example. And I think all of that is important when we are making comparisons, as inevitably will be done. And secondly, we are not yet through this pandemic, and this is not a comment about New Zealand, it's not a comment about any country in particular, but we're not through this pandemic yet. We do see in some countries that had earlier outbreaks, earlier restrictions and earlier lifting of restrictions, that we're seeing something of a resurgence in the virus. So I think it is too early to draw these conclusions. What I will continue to do is make the best judgments I can based on the best advice and evidence that I have, with that absolute focus on protecting lives and doing everything we can to slow and suppress this virus, and making those judgments based on what I think is right for Scotland. The virus doesn't respect borders and boundaries, which is why a four nations approach in the UK has always been important. But I equally will never shy away from taking a different approach if I think that is in Scotland's interests. Tom Peterkin from the P&G.
Good afternoon, First Minister. We heard at yesterday's briefing Professor Jason Leach made a plea for parents with sick children to use the NHS. He said that the NHS was still open for children with asthma, diabetes and other conditions. I just wonder, given the unexplained non-coronavirus deaths that we heard about last week, is the health of children of particular concern in relation to those unexplained deaths?
Well, as I said last week, and Gregor said too, that factor in the NRS report last week of a higher number of deaths in the week that was being reported compared to the 5-year average for that same week in previous years is a concern, because some of that was explained by coronavirus, some of it was explained by the registration anomaly that I described then, but we are not of the view that all of it can be explained by those two factors. So that is something we are looking at more closely. As I think Gregor said last week, this is a phenomenon that is being seen in other countries as well. So it's really important that we do everything we can to understand that, so that we can then seek to address any other factors. So I think it would be wrong to, at this stage, based on the information I have, to draw any direct link between that and what Jason was saying yesterday about healthcare for children. But this is a really important point. It's a point that has been made several times from these podiums in the last couple of weeks. And it's not just about children, although we all obviously have a particular concern about children who are ill getting the help and the interventions that they need. But it's a general point. There is a feeling out there, which is entirely understandable, that the health service is really busy because of coronavirus, so people are perhaps reluctant to come forward with symptoms that are not coronavirus. And our message is, please do not delay in coming forward. If you have symptoms that are worrying you, come forward. The NHS is there to help. And that is true for everybody, but for obvious reasons, we want parents with children to particularly hear that message. If there's anything about the condition of your child that is worrying you, seek help. Don't hold back from seeking that help because you don't want to put more pressure on the NHS. That's what the NHS is there for. Paul Mallock from the Courier.
Good afternoon. Dr Smith noted earlier that there were 50,000 deaths a year and urges the country not to delay funerals despite the setbacks that we're facing at the moment. Would you be able to provide a figure as to what the tipping point would be where mortuary services in Scotland would not be able to cope as a result of the extra deaths caused by coronavirus?
That's certainly not a figure I'm able to give right now. I will go away and see if we could give you a figure. I suspect it may not be quite that simple because, of course, part of the planning, unfortunately, to deal with coronavirus will also involve making sure that we have the mortuary capacity and the capacity for funerals that are required. But I'll ask Gregor if he wants to say any more about that.
So I think that, again, I wouldn't be able to provide you with an absolute figure just now, but I think the important principle here is the ongoing dialogue that exists between both Scottish Government and local resilience partnerships and actually the funeral providers, just to make sure that everyone is constantly monitoring the system to see exactly how they're able to respond, both to providing those funerals for people in a timely way, but also to make sure that that rather grim task of making sure that we've got adequate mortuary capacity is dealt with as well. Those discussions continue on a daily and regular basis, and we continue to monitor that.
Okay, Izzy Lyons from the Daily Telegraph.
Thank you, First Minister. You mentioned that later this week there's going to be a review on the restrictions currently in place. How likely do you think it will be that those restrictions are loosened? And secondly, care home industry figures have estimated that the current death toll in care homes in Scotland is now likely to be in the hundreds. There's one care home owner who's estimated it's up to 300. Is that a fair estimate in your view?
Well, on that latter point, we will have these figures on Wednesday when National Records of Scotland publish those figures. And with all of these things, I don't think it is helpful for us to speculate on what a figure might say when we know that figure is coming in a couple of days. But we know the Health Secretary standing here yesterday reported on the number of care homes where we know there have been cases of coronavirus, and that is just under 40%. We want to be able to give robust information on that going forward. But it is really important that the location of deaths is broken down in the way that NRS is going to do on Wednesday. And I think it's important that we wait to see what that shows us. In terms of the first part of your question, I think I covered this in my opening remarks. I would not stand here and give people any expectation that these restrictions are going to be eased come the end of this week. That is not something that is going to happen imminently in a matter of days. But it is important that as we go through this week, as we get more evidence, we look carefully at what is likely to be possible in the period ahead. And as we are able to, based on sound evidence, set that out to people, then we will do that as quickly as possible. But I would repeat what I've said before. We don't want these measures to be in place longer than possible, but while we judge it necessary, then it's really important that people understand that we do judge it necessary, and that is why we're asking everybody to continue to comply. Michael Blackley from the Daily Mail.
Hi, good afternoon. There's been a lot of discussion of care homes today, but there's a real concern from care home leaders that they're really being treated as the Cinderella service. They're hearing a lot of warm words, but not really much in the way of action. Robert Kilgour of Renaissance Care today says the Scottish Government's dragging its heels in providing similar funding, additional funding that councils in England have provided to the care home sector. Are we going to see more in the way of action, whether that be funding or additional supplies for the industry?
Well, I'll hand over to the Health Secretary in a second to give a bit more detail on that, but I do want to say very clearly it's not the case that care homes are the Cinderella service. people in care homes, both residents of care homes and the staff who work in care homes, it is important that they get the right support and the right protection as those who are in hospital, those who work in hospitals, or indeed in our community. And we have been working very hard, and I think the care home provider that you talked about this morning, and I apologise in advance if I have misheard or I'm about to misrepresent what he said, I think on the issue of PPE had acknowledged that that actually was something where there had been real progress. So these are issues we take extremely seriously and will continue, as evidenced by the pay increase yesterday that the Health Secretary announced. We will take very seriously the necessity of having the right support in place, but also making sure that we are reflecting the gratitude we have for people who work in our care sector as well.
So our care home sector is provided in two ways. It's either provided through local authority run care homes, or it's provided through privately run care homes. And I have a regular weekly conversation both with Donald McCaskill of Scottish Care, who represents those independent care homes, and with COSLA about what more they need us to do in order to help them respond to the demands that are being placed on them as a consequence of COVID-19. So far, I think it would be fair to say that on both their parts, we have responded positively to everything that they have asked us to do. And the reason for those continued weekly calls is to make sure that we can continue to do that we are listening to the issues that they are raising, working hard to address them, and working cooperatively with both the Convention of Scottish Local Authorities and, importantly, Scottish Care, to make sure that we do everything that we possibly can to give them all that they need to do the job that they need to do.
Thank you. Tom Gordon from the Herald.
Can you hear me?
Yep.
Yep. Hi there. My questions are actually for Dr. Smith. Can I just ask you to expand on your comments on funerals, and what exactly has prompted you to ask people to have timely funerals? Are you seeing a mismatch in the data between deaths and funerals, and are you worried about a backlog? Is it perhaps a sort of psychological range for people who have been excluded from the bedside to think about funerals? And what is a sort of reasonable time and days for people to organise a funeral?
Okay, thanks. Gregor.
So I think first thing to acknowledge is just how difficult this process is for everyone, isn't it? I said at the beginning that there actually, as a GP, all too regularly I saw the difficulties that people experienced as they started to process death of people who were close to them. So the funeral process is something which is really important part of our society, and actually allows many people that closure to be able to move on and start dealing with the grief in different ways. And it's not response to any kind of data that's particularly prompted this, but actually what we're seeing is anecdotal reports within the system of people starting to delay the process of going through their funeral arrangements with the thought in mind that perhaps if they leave it a little longer, maybe they can have more people at the funeral, maybe people who are currently self-isolating can kind of come to it when they're not currently able to. But of course, what that does across the country as more people try to take those views is that you start to get into a period of you get unfortunately a backlog of funerals that need to take place. We need to make sure that that doesn't happen, and today we've published 3 aspects of guidance with the kind of funeral management industry to make sure that we make sure that this very difficult process for everyone is treated with the compassion and the dignity, but also the need for the process to be completed in a timely way as is possible.
Okay, thank you. Chris McCall from the Scotsman.
Sorry about the delay there. Good afternoon, First Minister. Can I ask, are you aware of an online petition that is circulating today? It's launched by NHS staff, which claims that PPE currently used in hospitals is not robust enough, and whether you could offer assurances about the quality of the equipment that is in use at the moment.
I'm not aware of that petition, although I'm very happy to have a look at it, and we're very happy to engage with those behind it to try to make sure that any concerns are listened to and addressed, because, as I said earlier on, people do have concerns right now. This is a time of increased anxiety, particularly for those working in the front line, so we want to make sure that concerns are taken seriously and also addressed. The quality of PPE is as important as its supply, and there are ways in which we work to ensure that the quality of PPE is as people would expect. You'll recall at an earlier stage in this epidemic there was an issue about the expiry dates of masks that were being used, and they had gone through a process of revalidation to make sure the quality was exactly what people would expect to give the protection, because PPE will only be as good as the actual protection it confers. I'll ask the Health Secretary to say a bit more just about how we continue to ensure that supply and quality is addressed.
So our National Procurement Service has quality standards for all the different items under PPE. And I said earlier that when we are receiving offers from new suppliers to the market for any aspect of PPE, that part of what we have to do before we can know whether we can take up those offers is undertake due diligence. And part of the due diligence is assessing the quality of what they have to offer us and making sure that it is as good as we need it to be. So we undertake a number of steps to ensure quality, but as the First Minister has said, wherever there are concerns from staff, either about the availability of PPE, the speed with which it reaches them, or in this instance, if there are concerns around the quality, then we would very happily have those conversations to understand what those concerns are and see if there is anything that needs to be done, how we can go about that.
Last question today is from your Dickey from the Financial Times.
Thank you, First Minister. There's been a lot of complaints from small and medium-sized companies in the retail, leisure and hospitality sectors about the Scottish Government's decision to limit some coronavirus grants to one per property. Can you give us any sense of how much money that policy is saving compared with the UK Government approach, where that money is going, and if there's any possibility at all of the policy being reviewed?
I said last week, and I'll say again, we do keep these things under review because it's really important that we do as much as we can to support businesses. So I've heard those concerns, I've had discussions with the Finance Secretary, and we will continue to look at whether there is additional ways in which we can get support to businesses who need it, because the economic impact of this virus, and in particular what we're doing to try to control the virus, is huge, and it is going to get even greater. So we are very mindful of that responsibility. I want to be a bit cautious about your terminology, and I know it's probably just shorthand, but saying how much is it saved, because every single penny of the money we've had available for business support is going to business support. But because of the slightly different decisions we've taken, there are businesses who will get some support in Scotland who wouldn't get it in England within a particular rateable value band. As you know, we have also been able to make sources of support available to the seafood sector. We've provided support for help with water charges. There's been support for artists through Creative Scotland. There's been a support package for the bus industry. So there are different support packages that are available in Scotland that are not available elsewhere in the UK. And sometimes we've chosen slightly different ways of doing this, which is meant to reflect the slightly different shape of the Scottish economy. But yes, we will keep these matters under ongoing review and do everything we can to get as much financial support to businesses as possible. That concludes all of the questions we've got today. My thanks to the journalists and my thanks to everybody who's been watching at home. I hope you continue to find these updates useful. Obviously, we talk a lot about the measures that we have put in place to help slow the spread of this virus and protect the health service and save lives, and we continue to ask people to comply with those. But we are, and the last question there was an example of that in the form of the impact on businesses. But we know there is a much greater and wider impact on people of the measures that have been put in place and the restrictions we're asking people to live their lives by. And one of the impacts, of course, is on people's mental health. People are struggling with not seeing their family and their friends, of having to stay at home, of feeling more isolated than they normally would. So we want to provide as much support as we can for people to support their own mental health. For that reason, tomorrow at this briefing, I'll be joined by a mental health professional who will set out a bit more about the sources of support that are available and also enable us to give more information and answer some questions about that. So if you are feeling that you're struggling with your mental health and could benefit from a bit more support about where to go for help, do watch tomorrow, and hopefully the information that will be provided then will be of assistance to you. But for now, thank you all very much, and we will see you back at the usual time of 12:30 tomorrow.